Hi everybody, welcome to the show. I'm Forbes Riley, and my co-host is Kevin Harrington. You may recognize him as one of the original sharks of Shark Tank, or you might not recognize him as he's kind of upside down. But I would like to introduce you to the world's leading authority on inversion therapy, Dr. Carlos Gonzalez. Hi Doc, how are you?
Hi Forbes, it's great to see you again.
Well, it's great to see you, and I got to say I think Kevin's pretty excited because what are you actually here to do?
Well, what I'm going to demonstrate is my revolutionary chiropractic adjusting technique that I've been perfecting for the last 25 years.
Okay, well you got my co-host upside down.
Right.
Let's see, what are you going to do to him?
So basically what I'm going to do is I'm going to just grab his elbows like this, and then I position my body on his body strategically.
Oh my gosh, your entire back just cracked. Did you hear that?
Wow.
Wow.
I felt that, that's for sure. Woo.
Okay, my next.
Yes.
I could hear that all the way to Sunday. That was fantastic. Wow, I feel straight. Thank you.
You're very welcome.
All right,
Good
so
to see you
we're going
again.
to find out how all of this works in just a second.
Forbes, I'm back. I got a smile on my face.
Yeah.
You know why? Because I feel amazing. Did you hear?
I heard your entire back crack, and I'm jealous, and I'm up next. So, Dr. Carlos, explain to me, what did you just do?
I adjusted his spine while he was in an inverted, hanging upside down position, which gravity tends to decompress it, so it makes the adjustment more effective and easier to do.
Matt, you've been working on this for 25 years. I've never been adjusted upside down.
Right.
Why and why not? It sounded great.
There's nobody doing this.
Okay, so how did you come up with this technique?
After years and years of working on patients, patients get up from the table and they're like, Doc, I still feel something there. Can you try to get that one more time? And luckily, I learned about inversion therapy years ago, 25 years ago, but I was never taught the adjusting technique. That was something that I started to develop on my own from hit and miss with patients. Patients would get up and tell me that, and I'd try to adjust them again. And I said, come over here, let me hang you upside down. And I started playing around with it and using it on myself. I felt like I needed that.
So I've seen some of these products that you can actually hang from,
Right.
but you're just hanging. Now you have the doctor that can actually, while you're hanging, do the adjustment. It only makes sense that the gravity is elongating your body in some fashion.
So let's start with the problem.
Yeah.
So the problem is that gravity works, and it's designed to keep things on the ground. But there's spaces, explain our spine, because when you hear grandmas talk going, oh, I was 5'9", now I'm 5'2". What happened? How did they get that much shorter?
Yes. Well, here's the thing. As soon as you get out of bed, your spine is vertical.
Well, you brought a healthy spine.
Right.
Yeah.
Right.
So explain what's even in the spine, because it's...
Okay, so this is a segment of a spine, two spinal bones, and the disc. Okay, so as soon as you get out of bed, gravity starts to compress the spine. Okay, and the disc, which is approximately 70% water, and it starts to compress it. Think about a sponge. When you have a sponge full of water and you push down on it, where does the water go? It comes out of it.
Well, see, I don't know that people realize that this is kind of squishy.
Right.
And so when you say you slip a disc, maybe the disc is out here, or you've had to be fused. This is precious material.
Yes.
It's great when you're young, and what happens is we get older to it.
Well, it can deteriorate.
So now this is frightening.
Right.
Yes.
It can deteriorate to this, and not even when you're older, because by the time I was 30 years
up there,
old,
yeah.
okay,
Wow.
my discs in my neck, I had 2 discs in my neck that had deteriorated to a moderate degree, and they told me that I had the spine of a 70-year-old.
Wow, was that because of accidents or stress, or what happened?
I used to do yoga, I used to do handstands, headstands, and all that weight on my head and neck compressed my disc.
Okay. So now this whole inversion therapy, which has been around for a long time, that you can just hang upside down, that certainly helps, doesn't it?
It does, but it needed more.
Okay, so explain
It needed more. So that more just came out of, trial and error with myself and with my patients, and figuring out, well, what if I try this? What if I try this? And this is the technique that I've been perfecting over the last 25 years.
What kind of results do you get from people?
Oh, amazing, amazing, which many patients have called miracles. I mean, I've had patients come in to my office on crutches. Just the day before, when I came to the airport, I had a lady come with a cane. 40-year-old lady, severe low back pain radiating down her leg, and her boyfriend brought her over to me because she couldn't drive. By the time she left my office, she was no longer using her cane.
I can vouch for, I've been doing so much traveling lately, and I had this crick in my neck, and it just seems like it's now loosened up, and I feel straighter, and in just one session. So it's pretty amazing how that works. I want to ask you this though. You do this for individuals like myself,
Correct.
but you're also developing a system to actually bring other chiropractors into a coaching program. Correct. Or sort of an affiliate relationship with yourself.
Exactly. And the system that I use, it's a 5-step system, of which inversion therapy and my proprietary chiropractic adjusting technique is just one of the 5 steps.
Oh, wow.
Okay.
So I would imagine that I have personally gone to a lot of different chiropractors because the level of care varies. I don't know what they study in school, what the standard is, right. But some will just crack you and leave you, some will do muscle testing.
Right.
You take that to a different level.
Right.
Why are you so passionate about chiropractic?
I love it. Early on in my career, I had wanted to study to become a surgeon. And long story short, after having been in the Air Force for multiple years and having worked in a hospital, I decided that I didn't want to be a surgeon. I didn't want to have anything to do with traditional medicine.
Really?
So I was actually injured while attending the university, and it was a chiropractor that fixed my back. And it was one day that I'm laying down on his table waiting for him to come in that I said, this is what I want to do.
Wow.
I want to be a chiropractor and be able to help people like he helped me, because my spine was like really badly injured, severe pain, shooting pain that it would knock the breath out of me. I mean, if I turned a certain way, it would be like somebody took a knife and stabbed me and knocked the breath out of me, and I'd be like,
right.
Don't touch me. And so after having been fixed by a chiropractor, I said, this is what I want to do.
It strikes me that there's many people out there that are going from chiropractor to chiropractor, right. Even talking to surgeons about maybe getting, the knife and having surgery. So for anybody like that, they owe it to try one more time the inversion technique.
Absolutely.
Because it's, like you said, you've got people coming in that have done exactly what I just said, and now you fix them. So you got a couple other examples?
Kevin,
of
you're
some
absolutely right. I get patients all the time that have been to other chiropractors, have been to orthopedic surgeons, have been to physical therapists, and most of them are told, you need surgery, we need to do injections, and that doesn't work. And then they go back and they're told they need surgery. And so when I put them through my 5-step system, it's like magic. It really is.
One of the magic things really is the fact that you
Right.
create a technique
Right.
using inversion therapy, that you're upside down,
Right.
using gravity, because I would imagine even this kind of badly deformed disc, when you're hanging upside
Right,
down,
right.
does it release?
Well, it opens up.
And that's how you then
Right.
adjust somebody.
Right. It opens up and it allows, for example, if there's a disc herniation,
Right.
which is this little red thing in here, when that disc opens up, when the vertebrae opens up,
Right.
it'll actually suck that herniation back in. So when they're hanging upside down, they're like, I don't feel any pain.
Oh my gosh.
Now, half the time, or some of the times when they come back up from being upside down,
Right.
they're like, oh, the pain came back, but it's not as bad. And so I flip them back upside down and have them do certain exercises that I've been developing over the years, and along with some of my other steps that I incorporate into my practice, it's like magic.
Well, because I really do want to be really clear, and it always depends on the patient.
Yes.
That it's not a one-day miracle thing. You come once and bam, I'm healed.
Although that has happened sometimes.
Okay.
Like a miracle. I've had patients come in like severe low back pain, sciatic pain down the leg, one treatment, and they're like, man, I don't feel any pain.
Wow. But you can't guarantee that. I just
No,
want to
it
be
doesn't
clear.
happen all the time. Some patients need 2, 3, some patients need 5 sessions. Every patient is different. Every patient requires a different protocol.
But I'm in love with the fact that you are the only one that I've ever heard of, and you're in El Paso, Texas, if someone wants to come visit you personally.
Right.
And by the way, I think that's a wise idea. But that using this, which makes so much sense. I mean, when you hear some of the guys who preach inversion therapy, or just inversion, like literally just hanging, the physical benefits. If I was just to hang upside down, give me 5 benefits to my health.
from hanging upside down.
Just hanging. Before we got to you doing your miracle part.
Well, it does decompress the spine.
So decompression.
Okay. So it stretches the muscles.
You stretch.
So there's tight muscles, it'll stretch them out. Okay. If there's a curvature in the spine, it stretches it out and helps align the spine.
Is there a value to being upside down in terms of your blood?
And also, it increases blood flow to the brain, which is a good
felt
thing.
that.
Some
Yeah.
people,
I felt that.
Yeah, some people think that, oh, you know, the blood's rushing to my head. I said, no, 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 that's a good thing. Now, there are certain contraindications. I cannot hang every single buddy upside down.
Okay.
And this is where knowledge and experience comes in. You know, you have to look at every patient as an individual case because everyone is unique with unique circumstances.
Dr. Gonzalez, what's very amazing about what we've been talking about here today is you started this for your own practice,
Yeah.
but as the entrepreneur inside of you, you said other chiropractors around the world need to understand this is something new and exciting, taking your 25 years of experience in developing this and now offering it on a global basis. Really.
Absolutely,
So,
Kevin. And it was all the miracles in my practice that I saw the need that I gotta get this out to the world. I gotta get this out to the people.
So do me a favor, with that energy and passion, there's probably a chiropractor out there who wishes he knew a little bit more about this or how to get to you. Can you just reach out and talk to them?
Sure. If you're a chiropractor, and it doesn't matter whether you're starting out in practice or have been in practice for many years, and you're not getting the results that you're hoping you would have gotten with your patients, you need to contact me so that I can teach you what I've been doing for 25 years, and you can get incredible results with your patients as well. If you're a patient, if you're someone out there watching who's been told you've got a disc herniation, you've got sciatic pain, you've got scoliosis, you've got failed back surgery, you can recover. You don't need to have that surgery again or for the first time. You don't need those injections. We can fix it and help you recover so you can live a normal, healthy life again.
I have a question. I've had stuffiness over the years and allergy type things, and I seem to be breathing maybe a little bit. Is there any effect on that too, or
Kevin,
am I just thinking that I feel better?
Kevin, the results of the combination of chiropractic adjustments and inversion therapy is like nothing else, because chiropractic alone has been proven to stimulate your immune system and your immune function improves. And when you combine that with inversion therapy and the proprietary technique that I've developed, it's just unbeatable. It's amazing.
How do people find out about you?
They can go to my website. I have a lot of free resources and strategies that they can use. And they can get on my waiting list.
Oh, I love that. You know, and I'm actually very tempted to get on here, but I know we're on camera, and even though I'm wearing pants, you're very brave to go upside down. I'm going to wait till afterwards.
Does Forbes have to go on your waiting list, or does
wait a second.
We're going to make an exception for Forbes.
Okay.
Well, but I got to tell you, I think that there's people clamoring everywhere, and I'm so excited about you. So if you're a patient just like me, I have all kind of issues. I've been in car accidents. I have neck issues and lower back pain, and I haven't found a doctor, a chiropractor, who emanates that kind of love and caring and a sense of consistent growth. You and I are friends on Facebook. I've been a fan of yours for a very, very long time.
And I of you.
Thank you. And I truly think that, and your
too.
experience.
Anybody in Texas is very lucky right now, okay? Because El Paso, right?
Well, let me
people
tell
coming
you,
from all over the place.
I have patients coming from San Diego. I have patients coming from Arizona. I have patients coming from Austin to El Paso.
Right.
And I asked this one lady, I said, when I found out that she drove, her and her husband, okay, and these are people that are in their late 60s, why did you drive all the way to El Paso? You know, I thought they were coming to visit family or something. Right. I said, why would you come all the way from Austin to El Paso to see me? There's a lot of chiropractors in Austin. She goes, because I trust you.
See, let me tell you something. If you have someone, and I am this person, who's ever been out of work because of back pain, who sometimes I sneezed, stepped off a curb, threw out my back. I've been on my knees for an entire day in pain. I may have to just bring you with me. So like Kevin said, lucky enough to be in Texas, but as long as you get on an airplane, I have a feeling your business is going to be international. And the best is, if you train people to do this kind of therapy so your genius and your wisdom can be spread worldwide, you'd be doing us a big favor.
Thank you. Well, you know, it's already international because I live on the border. And I can't even begin to tell you how many patients from Mexico, Chihuahua, Aguascalientes. I recently had a man from Aguascalientes, 77 years old. He got on the inversion machine, I adjusted him. He got up, he was like, esto está fantástico.
Oh, me gusto mucho. I'm not waiting anymore. Our interview's over. I adore you. I'm getting on here.
Thank you.
Thank you for your kind help today.
Thank you so much.